Hi, Dr. Pelto here. I want to talk today about a 70-year-old female that had Achilles tendonitis. And she came into the office. She was having pain to the right Achilles. And when you talk about an Achilles, there are two areas that can be painful. There is one where the tendon inserts into the bone, and there's another one that's right above it, a couple of inches above it. There can be pain in there. And in this specific patient, when I pushed on her Achilles tendon, there was thickness to the Achilles, and what we call it is bulbous changes, or it gets thicker than the other side. So one side was definitely thicker than the other. It was painful when I saw her. And when I saw this female, she liked to be active. She couldn't be as active as she wanted. She was limping around and she wanted treatment. So let me explain the treatment and kind of what was going on. So I'm going to show you some pictures in a second, but basically, because of her inflammation, the initial treatment was she had some tightness. So we did a night splint to help her. We did foam rolling for the calf to help loosen up the calf. She did a course of an anti-inflammatory, a prescription strength of Celebrex for 2 weeks, and she did icing on the area, and that's about how she started. And so I'm going to go over and explain a little bit about the anatomy and kind of what we did at the 2-week follow-up when she came back. Okay, so let me share what this patient had. She had pain right in this area. You can see in this black and white image there, this looks like a bulb right here, almost like a thickening of the Achilles. This is called Achilles thickening, and this is caused by little micro tears that happen in the Achilles tendon. The other area that can hurt on the Achilles is back here where it inserts into the bone. Now the challenge with an Achilles tendon, if you look at the Achilles, this is an example. There can be little micro tears that happen, and when they try to heal, they get thickened. They get scar tissue in them, and that's what causes the Achilles tendon thickening in the area. So if you imagine if you have a normal thickness and then all of a sudden it gets thicker, it's going to be tighter. So it's going to pull more, and that's going to become painful. So part of the treatment, which I mentioned before, for this patient, we are going to do foam rolling. So she's going to do foam rolling of the calf to try to loosen up that. So if there's less pulling here, there's going to be less pain on the Achilles insertion. So that's one of the treatments. The other thing she did, there's a splint that we use to hold the foot up called a night splint. It goes around the back up to the toes, and that pulls things up as she's either sleeping or watching TV at the end of the day for a few hours. This is very, very helpful for this patient as well in terms of loosening things up. I'm going to show you now a kind of a grid that I use to talk about the different types of treatments. When we're talking about treatments, there are certain treatments that are most effective and others that are least effective. And this is based on the patient's x-rays and ultrasound specifically. So I'm going to show you her ultrasounds a little bit, but let me explain. When she first came in, I got x-rays. And then at the second visit, when I did the ultrasound. So let me first talk about her initial treatment. So initial treatments, when she came in, I did a therapeutic course of anti-inflammatories. So when you're talking about effectiveness, there are certain things that are most effective, others that are least, and we work on reducing the pain, reducing the tightness, and reducing the stress through the Achilles tendon and the foot and the lower leg. Initially, we started with anti-inflammatories. She did icing and contrast baths. A contrast bath is 5 minutes in ice water bucket, 5 minute in hot water bucket, and 5 minutes in ice water bucket again. She did a night splint, and she did some home therapy with foam rolling, and she did supportive shoes. That's how she started. Okay, and I'm going to show you right now her X-ray images. Okay, what I'm seeing here are two pictures. There's one on the right and one on the left. The left one is her original X-ray, and I didn't see much on the X-ray. If you look, there's a normal foot. Looking at the side view, everything is normal. At this exact side view, you see a little spur on the bottom of the heel. You don't see a big spur on the back of heel, and there's no big bump. So on the X-rays, everything looked fine. When she came back in for the follow-up visit, I got this area here, which is an ultrasound. So I'm going to focus in on the ultrasound, and it's going to be a little bit easier to see things. So let me just pull up this ultrasound view. Okay, so here's the ultrasound view for this patient. If you notice, there's some thickness here and other thickness here, and this is where it's all bulbous. It looks bulbous, and hers was measuring 15.3 millimeters. That's a lot larger than normal. And a couple of other areas you're going to be able to see, these black areas right here, that shows areas of swelling, and you can't see normal fibers. You would like to see normal fibers in the Achilles tendon. And specifically, this is an area that I saw when I did a side view. You can see the area of swelling around the edges, but there's one focal area in the center here where I think she has a little bit of a tear and swelling around that. So when she came in for the second visit, based on this ultrasound, we decided the next course of treatment was a combination of shockwave therapy and an amniotic injection. So the way I explained it to the patient is that areas that are tendon, they tend not to heal that well because they get stalled. And so shockwave, it uses sound waves to hit the area of the Achilles tendon, increases the blood flow, helps to heal. And there's really no downtime with that. So we're going to set up 3 sessions. She needs between 3 and 6 sessions. I do them a week apart. And then usually at the second session, that's where I'm going to do an injection of this amniotic injection. So it's a amniotic cells. They come from a donated mother, and they take it from the amnion and they freeze dry them, and I inject them in there. So I do that with ultrasound guidance. So it's one of the only things that you can inject into the Achilles that's safe. You don't typically do cortisone because it could cause a rupture, but these cells you can. So on the second visit, I do the shockwave first, and then I am going to inject that into the area of the Achilles. And then also I put her in a walking boot for a week just to kind of rest the area. And then it takes about 6 weeks, both for the amnio to work and as well for the shockwave to work. So it takes some time. You have to be patient with that. And then I do usually a 2-month follow-up after. And many times after that, after the shockwave, I'll do a course of physical therapy. So that's kind of how I'm treating this patient. This is a very kind of active 70-year-old patient. And I will keep you informed. I'm going to put a couple of links underneath this video. One is the actual patient resources I give to my patients in the office. I'm going to give those to you because you've watched till the end. I think you'll enjoy this. It'll give all the resources of how to do foam rolling, different types of treatment options. Once again, if you can't see me because you're not in Massachusetts, post any questions underneath this video. I'd be happy to try to answer it. Once again, we can't give medical treatment through these videos, but I hope this is beneficial and give you some guidance. Okay, thanks.